Another time when shaking it out is really useful, folks, is getting out of bed in the morning. You've had a nice night's sleep, you're more or less comfortable, but you got that little backache, you got that little twinge going on, and you jump right up out of bed and get going. What does that look like? You get out of bed, everything hurts, it's stiffer than hell, and you go try to walk it off, and your first 3 steps, everything's seizing up, right? But you gotta go get that coffee. It's things like that that seize up the system and set you up for pain all day long. Okay, an alternative to that is to use our shake it out strategy, where you're lying snoozing away. Instead of just getting up out of bed straight away, you kind of roll over onto your back. And we're going to put to use some of our eraser moves on this, right? Great eraser move, knee to chest. Grabbing one knee, pulling it into your chest. Fingers interlock tightly over the knee, not the shin. Leg goes out nice and straight. And you're holding it and you're breathing. And we don't have to get too uptight about time. 3 or 4 good breaths with each stretch. And then we'll switch off and get the other leg. This is really loosening up the hips, taking the fluids that have settled in the joints and we're getting them redistributed. And then there's that. And then she can put her feet flat on the ground right there, and lo and behold, we've got butterflies. Butterflies are a great exercise for just kind of getting things moving again. And then from butterflies, we can do some nice, easy, single leg bicycles. The knee comes back toward the chest and the foot goes up toward the ceiling and down. 2 or 3 times each leg. And then after 2 or 3 times each leg, we can combine them and do both legs. Just a couple of, good. Very nice. Then the feet can go flat again, and we go into some pelvic tilts. Little pelvic tilt action, release. 3 or 4 tilts, and then you can go up into a thrust a little bit. There you go. A little bit slower, a little bit tighter on that form from someone who knows better. There we go. Good. And then how about some knee rock backs, Mare? And then let's let the hands down to the side and give me a few active squeezes. Bring those knees back. Nice. Very good. A little too far down. Squeeze. Okay, then sit up on the edge of the bed. And from there, we can pick up just like we would if we were sitting. Some knee pumps, some butterflies. We go through them all quickly one more time. And then from the very first minute you put your foot down on the floor, you're much more comfortable, moving much more freely, and a lot less pain.